At the end of this month, you will complete the 7th month of pregnancy. Any news about you? There's something amazing about your baby. Food tip of the week, by the way, very cool. You know what? So stay with me and I'll tell you. Hello, I'm Monica Romero. I'm very happy to have you here with me. I love these whole numbers. It seems like they mean so a new era, and almost is. But now it's an era of gaining a lot of weight. Look at the size you are on your belly from the first day of your pregnancy, and now you should start gaining about 500 gram per week. You remember what I told you, right? Not to exaggerate. The eating at the beginning of pregnancy, that now in this final stretch, we gain a lot of weight, a lot because of the baby, of course, but also that it is our body there producing more fat, more liquids, so that we can also prepare for childbirth. Birth is an important moment that our child is born, and a new stage for our body, which will stop feeding our baby through the umbilical cord to be able to feed our baby through breast milk from that 30th week onwards, that whirlwind. Of emotions that we had a lot at the beginning of the pregnancy, they come back, and they come back with everything. So be very careful with what you watch, with what you are inside a movie, a book. If they are things that impact you too much, that make you too sad, it is better to avoid and be shaken by these things that you are watching or even that you are going through. It is normal. This does not mean that you are a candidate for postpartum depression. But there is also depression during pregnancy. It is little talked about, but it is a reality. So if instead of being shaken, you have sadness that lasts a long time, aren't you seeing colors in your life? Please seek medical help. You do not need to go through this alone. It is not a shame. It is not a weakness. It is a condition that perhaps pregnancy has brought you. And if you treat it now, the chances of you continuing this treatment and not evolving into postpartum depression or having a treatment. So suitable as soon as possible for you to enjoy your pregnancy and enjoy your baby are greater. So please take care of you. I'm asking you from the heart, okay? With all the anxiety, I think anxiety is one of the strongest words right now for this 3rd trimester, because guys, it's almost there, huh? 10 weeks tops, the baby can be born from 37. At 37 weeks, he is no longer premature. He's being considered a baby ready to come to this side. So he's coming. And when it's coming, the anxiety gets bigger. Due to anxiety, we can start to have insomnia because yes, our sleep is closely linked to what is happening here in our head. I'm going to ask you to start training yourself a sleep routine. And then this routine will evolve into your baby's sleep routine, which will be very important for him to sleep more at night. And in this sleep routine, one of the tips that I think everyone already knows, but I will reinforce, try to avoid screens. Television, cell phones, iPads, all of that, those lights end up leaving our brain too connected and driving away our sleep. There are some tips to dim the light of the house as a whole. This also helps because our brain is already beginning to understand that that most primitive part of us is getting dark. When it was dark, we went to sleep. That's pretty much it. All this will help. But I have to agree that there are some TV shows, some voices narrating the little animals, and I don't know what. You have to get a huge sleep, right? But if by chance it's not a program like this that makes you sleepy, try to avoid a little screens, avoid caffeine. It's also been around 6 o'clock in the afternoon, nothing like that. It's starting to get dark for everything that has caffeine is coffee, mate tea, soft drinks. Cut all this and go for a lighter diet too, because if you have poor digestion, it will also disrupt your sleep. A tip that I already gave 2 weeks ago talking about taking a notepad the time you go. Sleep. Because if any thought appears and you stay thinking about it, you write on paper, that will take the weight off your head because she will know that tomorrow you can consult and research better about that or think better about that subject. Are tips that can help you, and of course a bath before going to bed is too relaxing. Also advice saw with that hot water hitting the back. Oh, what relief you deserve. And let's talk about your prenatal appointments. How are they? You're doing great, aren't you? Because now your doctor, right, your obstetrician, he should ask you to repeat some tests that you did there at the beginning of pregnancy, and we'll have some new tests to do. For example, he will ask for a blood count for you, and in this blood count, he will see how your iron is due to anemia, hepatitis, ABEC, syphilis, HIV, toxoplasmosis, rubella, herpes. Wow. There are several tests that he will ask you for now, and one of the most important, you will have to perform it, is physical, not blood, okay? The urine test will also ask for the urine test for you to see if you have urinary infection, which in pregnancy, unfortunately, is very recurrent. And a very important test, which is done between 35 and 37 weeks of gestation, which is the Group B strep test, is the cotton swab test that scares a lot of pregnant women. He is, yes, uncomfortable, I won't lie to you. You go to a laboratory, you will be in a gynecological position, and a nurse will swab your vaginal canal to see if you have this bacteria, because it can infect the baby during a normal birth, and this is dangerous for the baby. So what happens? You did the Group B strep test, it came back positive, you will be medicated, and you will have to repeat this test to see if it will come back negative. It was negative, okay, you are free of it, but please, this is the result of all the tests you do now in the 3rd trimester. You have to separate it in a folder that you have to present at the time of hospitalization for childbirth, okay? Whether it's normal, cesarean, or unknown, you have to have those scans on hand. In fact, if you don't take strep, it will be carried out again in the maternity ward. We don't want to go to the hospital, right? We experience as little discomfort as possible, so please talk to your doctor, see about these exams and schedule, and leave everything organized in your schedule so that you can get it out of your head and sleep more peacefully. And the last thing about you, I'm going to ask you to be aware of the risks or symptoms of pre-eclampsia. I talked about this a lot last week. I'll leave the link here for you to go there and watch. Remembering that the images I use in the video, you can also find there on my Instagram, Almanac dos Pais, already asking for the addendum, already leave a short in this video here for me that helps me a lot. And it's important that you pay attention, especially if there's sudden swelling in the hands, feet, face, weight gain, you know? It seems very significant from one day to the next. It's also important that you seek medical help, okay? Pre-eclampsia is life-threatening for both mother and baby. You can't play with it. You have to keep a close eye on it, okay? And after talking again about such a complicated subject, let's bring a little lightness. Let's make the weather here more pleasant. Let's talk about your 30-week-old baby. He's already a big baby. He is already measuring about 40 centimeters from head to toe and weighing about 1 kilo and 400 grain. Now he won't grow as much, but he'll get a lot of fat. Your body's all in shape, except it's got a little extra energy this week, going to Pititico's brain development. When he is born, there will be millions of neurons just waiting to be stimulated to create all these synapses that he will develop throughout his life, but mainly until he is 21 years old, peaking around 3 years old. These synapses have social creativity, development with the environment. There are many stimuli he will receive after he is born. And all this will make such an important part of your baby's character as well. This part of values that we pass on to our child. And value is what we don't negotiate, we learn in early childhood, up to 5 years of age, then up to 5 years of age, that we show the importance of family, integrity, honesty, being good, all this part of formation of character that cannot be negotiated up to 5 years of age. So enjoy all that your baby is there, a little sponge to receive everything that he has so in the world to learn from you. Take advantage of this opportunity, but we will talk a lot about this in the development of your baby, which you will watch as soon as you leave pregnancy, week by week here. Come on, hear of the most. And I've already talked a lot about the woolens, which is that Lanugo os pelinhos, right? That fur that's covering the baby's little body. Now in the 30th week of pregnancy, it starts to fall. It starts to come loose there in the amniotic fluid. It's going to be swallowed by this baby. This solid part is deposited there in the large intestine, which will become the meconho, which is the baby's first poo. It is normal for premature babies to still have plenty of these lanugium and even full-term babies. It's the name you give when you're born. After 37 weeks, you still find these little hairs, especially here on the face and on the back of the back, like in this picture you're seeing. Do you remember when I told you that the baby's spleen and liver had taken over the function of producing blood there? And now the bone marrow too, it's already taking over its function and producing red blood cells. Today, your baby is swimming between 500 and 700 milliliters of amniotic fluid. It is quite liquid, and this liquid will decrease as the pregnancy evolves and your baby grows more. In fact, if you perform an ultrasound, one of the things that will be evaluated is the amniotic fluid. What is the amount, right? What about your placental degree? And with this baby growing up, it becomes more difficult every day for him to be able to move in his belly. Although he's getting strong, this is important, he manages to press the walls of the uterus. Your little bone is already firm. It helps to get muscular, get strong. Despite being super important, now these movements are more difficult. Then you will notice that he will move less, but still with a lot of intensity. But since he still has a little bit of space, he can still be in various positions. He can sit upside down or even on his side. He still has 10 weeks to stay in the cephalic position, which is a head down position, to be able to provide a normal birth. But remembering that it is also possible to give birth when the baby is sitting, as long as the doctor is already used to this type of birth, okay? But however, a transverse baby that is listed on the side of the belly, this is an indication of cesarean section. But if your good baby stood there upside down, there's a moment when he's going to be able to fit his head there in the pelvis, and then the lungs are free, you can breathe again. But the bladder, oh poor thing, that desire we had to go to the bathroom in the first trimester is much more intense now. But every time you go to the bathroom, even if you are going 10 times an hour to the bathroom, always remember to empty your bladder enough, even if you have to squeeze there to help. This will also help prevent urinary infections. We have to try to empty our bladder as much as we can. And if it's really empty, it will take a little longer for you to go to the bathroom again. It's worth it, right? Last week, I mentioned to you that his retina was already formed. An interesting thing is that for several weeks, if you put a flashlight on your belly, it will already follow. He can follow that movement in the flashlight, can't he? From the light, but when he comes to this side, the light out here is very intense, and it will be very difficult for him to open his eyes. This is why many people choose to, at the time of delivery, reduce the light in the delivery room so that the baby does not have such a strong light shock. If you don't know about this, I will point you to this video that is here, which is about birth plan, in which it explores all the options of a birth for you. A birth plan is not a contract that what is there has to be done, but it is a great opportunity for you to talk to your doctor and understand the possibilities, and also deliver to the hospital who is responsible for your birth. To know everything you want is you help a lot, because when you have there in the contraction, we can't even talk. We will just stay focused. Even then, a birth plan can help you a lot in guiding people to everything you want. This birth plan is the same I made in a PDF. I let you also download it. It's here in the video description for you to download. This will help you a lot to understand what your possibilities are and bring you the best birthing experience possible. Even in the SUS, you will find doctors, nurses, and hospitals who will understand a birth plan as a great guide to be able to make your birth amazing. What's the latest news? It is that now your baby's fingernails and toenails are already reaching the limit of the finger, which means that after delivery, perhaps on the day of delivery, you already have to cut your baby's fingernails. Look at that delicacy. Some maternity hospitals do that for you, okay? With the nurses, they can do that for you, but there are others who won't. They really let dad or mom or grandma or godmother, somebody take over that role if you're insecure. Believe me, I was really upset when Lucas was born. I had to do this. I was really nervous, okay? If you are unsure, ask a mother who has a small baby, or your mother or mother-in-law, that they will do it for you. Soon you will be cutting your baby's nail upside down, but the best time to cut is still when he is sleeping heavily, but you will be able to do it, okay? But at that first moment, being insecure is perfectly normal, and asking for help is always good, right? We have to delegate a little so that we can also relax. Important. And now let's go to my eating tip this week. I'm going to tell you the same thing that I indicated in the first video I made of 30 weeks of pregnancy. You like coconut water, but take that natural coconut without preservatives, that really good one, you know. You buy that green coconut, put it in the fridge, then you open the coconut, drink that wonderful water. Look at the properties it has. It is rich in potassium, which reduces cramps. It also helps in the functioning of the intestine to get rid of that damn constipation. It's low in calories, 0 fat, very nutritious, and it's still a diuretic. It also helps us get rid of fluid retention. Is there anything better than coconut water? By the way, it's already made me thirsty. I'm wanting coconut water too, see? And finally, in my tip of the week, have you arranged your baby's room yet? How's the organization out there? You must have already done several inspirations or have already done some renovation. You must have already acquired the furniture at that time of the championship, because otherwise now you will have to take prompt delivery. That's what narrows our options, right? Our possibilities. Always remember that the crib has already met the standards. I will leave this image here for you so you can see everything you need for your baby's crib to be safe, paying close attention to the gap between the rails, okay? It cannot exceed 6.5 cm with the risk of the baby catching the little head. Another very important thing, I know the crib is beautiful, but the crib kit can cause suffocation in the baby, and it collects a lot of dust and can cause allergies in our piquero. It is also not legal. The baby's article has to be clean, which means that with the least thing that can gather dust as possible, without plush, without too many niches, but we want a niche. If we want to, we will have to clean it, so we clean it up. Beware of curtains. Try to get those straight curtains, which are easier to clean and accumulate less dust. If you opt for curtains that have voile, that have cotton, which are the ones that are looser, they are beautiful, they are incredibly light, but you will have to wash them very often, as we don't want dust in the baby's room. And finally, if you arrange the whole baby's room and make it perfect, only if it is to take a photo, including this month is now incredible, to take a photo of the belly. We still have the disposition, take the opportunity to take a lot of photos, hire a professional, make the room, and then the room is set up and the photos are over. Put away all the sheets, put away the blankets, put away everything you can so you don't get dust. We're just gonna tidy up the baby's room, put sheets on the crib, make everything perfect. When we come back from the maternity ward, because then we know that everything there is super clean and dust-free. For our little baby, who is our most precious and beautiful little thing, it is already missing a little, missing 2 hands to arrive. Let's do a countdown. Tell me what is your probable date of birth, and I will know until when you are watching this video. By the way, I hope you enjoyed this video. If you liked it, don't forget to leave a like for me. I'll see you in the next video.